because in as much as, you know, I was diagnosed with depression, I am living with depression and anxiety, but that does not define me. I'm still Pinky at the end of the day. I'm not depression. I don't walk around as depression. I walk around as Pinky Gwebu. You know, I walk around as Mama Zilibushe, you know? So I think it's like I said, like we said in the beginning, nobody is immune to it. Not everybody will get it, but certainly should the need arise, don't be ashamed in seeking help. I'm not ashamed of the fact that I'm a psychologist living with depression.
Hi, starters. Again, I have a special guest, someone, guys, when I saw her profile, it's a mess. It's a serious mess. So her name is Miss Pinky Gwebu. She's a clinical psychologist, graduated her undergrad with Magna Cum Laude. If you don't know what that is, I'll leave her to just give you a snippet of what that is. And where she did this was at MGI, Midrand Graduate Institute, which has since changed to the Pearson Institute for Higher Education, still at Midrand, of course. Then she moved on and did counseling for like a year. She then enrolled at MEDUNSA for her master's in science and clinical psychology. Now, obviously, we all know it's Sefako Makgatho Health Sciences University. I almost fumbled that one, right? And then she completed a 12-month internship within the Johannesburg chain of clinics, and then Charlotte Maxeke Hospital as well under the Wits Circuit. This was followed by her community service at the Boksburg Prison. So I like the fact that we're speaking to someone who's pretty well-rounded, right? She's currently employed by the Gauteng Department of Health under the Ekurhuleni Health District. Her special interests lie in neuropsychology, family and couples therapy, as well as intervening in bereavement and grief therapy. She also works vastly with individuals presenting with different forms of mental illnesses, which is why essentially she's here today. How are you, Pinky?
Yeah, that didn't sound like you were talking about me, but
I
was. It's always so refreshing to hear someone else say it. But I'm doing okay. I'm doing good. Looking forward to having a productive conversation. How are you doing?
I'm good. I'm excellent. And I'm excited to have you on this platform. Firstly, with all this, there's a PhD on the line. I actually forgot to mention, guys, that she's also working on a private practice. Now I'm wondering, or with working on a private practice is now a PhD on the pipeline or what?
A PhD is definitely in the pipelines. Yeah, I'm just still raising my kids. Ish. You see,
Yeah.
once they're a bit grown, I'm giving them 2 years actually to grow as much as possible, and then whatever they don't do in the next 2 years, they're gonna miss mommy. Mommy will be doing her PhD.
Wow. And then let us touch base on the Magna Cum Laude for us who don't know what it is. What is Magna Cum Laude?
So it's basically passing your degree with distinction, but not just 5 distinctions. So they looked at the academic record from the first year until my honors year. So in total, I think I had about 30, if not 40 distinctions. So
Mind blown.
That's what it means.
Mind blown. Did you hear that, guys?
Yeah.
It's basically raising the caliber of this platform. So thank you so much, Pinky, for just being with us. Just now to outline the conversation and what it's all about. We're talking mental health. Obviously, the trending topic right now. Over and above it being a trending topic, we don't want the conversation to die down. So when we have platforms such as YouTube, it's things that even a year, 2 years, 3 years from now can still pop up on your feed. and
Yeah.
it may actually save a life, or it may resonate with somebody. It may help somebody understand their current situation in relation to mental health. So we'll be speaking broadly about it. And in speaking broadly about it, kindly enlighten us, what is mental health all about?
So mental health is generally looking at one's emotional functioning and how the brain also functions, being it under periods of complete joy and stress-free, or periods of stress as well. So mental health is about keeping the emotional part of us quite well functioning and well-rounded. So in essence, that will then include how obviously the brain functions, how we function during stressful times, how we function during even these hard times that we're living in with COVID. So it's about maintaining a healthy state of mind and emotion. I say healthy and not normal, because normal is, vast and different depending on context. So the point is to just maintain a healthy state of mind and a healthy emotional state.
Okay, does it have boundaries then? Like, does it matter who has it or who doesn't have it?
It doesn't really matter. I think everybody should generally be striving for mental health, because if you don't, we see the implications on how a person is now struggling to cope with other areas of their lives. So there's certainly no boundaries when it comes to who must maintain mental health and who mustn't. Everybody needs to work on their mental health. And I think a lot of us tend to do it in a very passive way. We expect it to just happen. We just go with the flow. But keeping your mental health in a good state, it actually needs you to actively participate in things, activities, and engagements that will keep you healthy mentally. It's not something that randomly happens, It's something that you actively have to work on.
So it's regardless of race, it's regardless of wealth or class, status, it's regardless of age. We all need to basically work on that aspect of our lives.
Precisely. I think, traditionally, fields such as psychology and psychiatry were quite limited now to the white population, But I think as the world and as a country as well, we've come a long way. We've come a long way in terms of being more inclusive, and mental health is just one of those areas that, I'm finding as a Black person, more and more people are actually coming through and seeking help in maintaining their mental health. I'm finding that people are trying to understand. Yes, there is still that we don't discuss our private issues with strangers in some aspects, but I'm seeing a lot more people becoming open-minded. So there's no boundaries. Everybody across races, across, careers, across even, financial abilities. Everybody there's no one who can identify themselves as being immune to struggles of mental health. There's no one who can actually, go by in life without actually taking care of their mental health.
And you know all about that because you worked in a clinic, you've worked in a chain of hospitals, you've done counseling therapy, you deal with different people within society as a whole, and you've also worked in a prison. So you have that diverse exposure. So when you specifically say there's no boundary, it's pretty clear where you take them from. Now, looking at us as human beings, right? Society, when we think mental illness, we just think depression. Is depression the only thing that we should think about when it comes to mental illness?
Oh, definitely not. Far from it. Far from it. There's various kinds of mental illnesses. There's hundreds, if not thousands, of mental illnesses that one can have. But depression is certainly one of the most common ones. Hence, it is spoken about so much, but it's definitely not. And I think one thing that we should understand is that, you know, mental health, it exists on a continuum, right? If you think about a continuum, it's like, you know, a functioning on like a straight line, where on the one extreme, it's people who are mentally healthy and, you know, they're doing well, they're coping. If they need therapy, if they feeling, you know, some type of way, they're able to seek help. Then we have other people who are just, you know, living just in the middle, where perhaps there is mental illness, but it remains undiagnosed and they are just functional despite having that mental illness until such a time that there's a crisis or something triggers them. And then we have other people who are living actively with mental illness. They are known, we call them our known patients. You know, we know that this person is struggling with bipolar. We know that this person is struggling with schizophrenia. We know, so there's a vast variety. And I think people cope with things differently. I'll give you an example. If you think about losing a loved one, right? Some people see that as, you know, something that is normal. It happens and they try to push back their emotions and they just carry on. Okay, that is all good and well when you think about what needs to happen during the time of organizing a funeral. Because think about it, during that time, you need to run around, call people, and, you know, so putting up that facade that, okay, everything is fine, I'm going to be okay, the family is fine, we are coping, it makes sense. It makes sense because things need to get done. But what starts to happen is that the very same person, a few months, weeks down the line, they find themselves in, you know, this downward spiral, emotionally not coping, emotionally sad. And it's very easy to diagnose a person like that with depression. But, you know, if you look at the context, if you come back to the fact that this person is grieving, this person has lost somebody that they love, does it then not make sense that this person must be sad?
It makes hella sense.
It makes a lot of sense that they must be sad. It makes a lot of sense that, you know, they may be filled with anger. It makes a lot of sense that, you know, they are very emotional. So there is, you know, a huge number of mental illness, things such as loss and bereavement. You know, it can cause acute stress. It can cause what we call acute stress, where a person is struggling in the immediate here and now in reaction to the situation that is happening. You know, I always tell people that, you know, we need to, you know, strive to not fight our emotions, because 99% of the time, in my experience, your emotions will always make sense given the circumstances that you find yourself in. If you are grieving, it makes sense to feel sad. If you've won the lottery, it makes sense for you to jump for joy and start making plans for the future, you know. 100%. So instead of fighting our emotions, we just need to experience them, and with the understanding that as much as they exist, they do come and go. So people tend to not address emotional distress for whatever reasons that they may give. And a lot of the time, that leads to the bottling up of emotion. And eventually, you will find that the person is struggling with a particular mental illness because they haven't dealt with, you know, the initial pain. They haven't dealt with the initial trauma, the initial loss, and so on. But that is also not to take away from, I guess, the biological component of mental illness. But I guess we'll get to that as the conversation continues.
Yeah, definitely. So how does one recognize that along this continuum of mental illnesses, how does one recognize that I may have fallen on the flip side, the negative side of that? Because you spoke about acute stress, you spoke about, we initiated it with depression, but you also went to the far extremes of chronic health illnesses, schizophrenia and the like. How does one know and can recognize that I am at this particular point?
So one of the most identifying factors that we always look at, and that you should look at for yourself, is how I'm feeling or what I'm going through affecting my day-to-day functioning. That's the first thing we look at. You can be going through a rough time, but still be functional, right? You can be going through a depressive episode, but still be functional, be able to get out of bed, do what you need to do, but you feel the depression mentally. For a lot of people with mental illness, it starts to affect their day-to-day functioning. You will find that people will say, I'm unable to get out of bed. I'm not meeting deadlines at work. I am very forgetful. I've become, socially isolated. I don't want to see people. I don't want to speak to people. So the moment your feelings and what you are experiencing is affecting your day-to-day functioning, that's a big telltale sign that, you need to get help. The moment you start, not being able to do your tasks of daily living, this may be something as simple as taking a shower, meeting deadlines at work, taking care of the normal needs of your family, taking care of yourself. Some people get to actually a point where they can't take care of themselves. So those are the telltale signs that actually I should be seeking help. So how you are feeling is affecting your emotional functioning, but also your daily functioning. If your daily functioning has been affected, then you know you have a problem.
And then speaking of recognizing the triggers, earlier on you mentioned loss as one of the triggers, right? What other triggers should people be looking out for?
Okay. The number one trigger that people often overlook is change, Change is something that can be daunting to a lot of people. And that means that, the adjustment period is very difficult for a lot of us when there's a big change that is happening in your life. If you look at the past 2 years, we've had to deal with our lives basically being turned upside down by this COVID pandemic. And during that time, a lot of people struggled with their mental illness because what is this? What is this pandemic? What is it doing to my family? I'm losing family members. What is it doing to my job? So change is one of the things that triggers a lot of people, but also there's other elements to that. Things like, we've spoken a bit about loss. Loss, I think people always misinterpret it to only be loss of a loved one. But loss, there's different kinds of losses that people suffer as we go through life. Loss of a job, loss of a relationship, loss of a partner, loss of control over your life, loss of, for people who are actually physically sick. You get people who get amputated, for example. They also go through a grieving process that is similar to when one loses their loved one. It's because it's also a loss. Because a lot of people, like I said, tend to, not consider the day-to-day losses as significant enough to warrant a mental illness or warrant you getting care from a professional. So, and that also, when there's a loss, what does it mean? You have to adjust. There's adjustments that need to be made. If you've just lost your job, you need to adjust to now not being able to be the breadwinner for your family. And what does that mean? So the implications are always far-reaching. So loss, we've spoken about loss, change, and another thing that is quite significant is trauma.
Trauma, yeah.
Yes. trauma is one of those things that, we see on a day-to-day basis. And trauma is not just you personally going through something, but it may be you witnessing, a horrific event, an event that is life-threatening to someone close to you or even a stranger. We have different types of traumas, like people getting sexually abused, being involved in a car accident, witnessing, these horrific crimes, things like being in hospital, actually being sick. People do develop, a trauma response to being sick for prolonged periods of time. So trauma is definitely a trigger. Another one that is quite significant is conflict. Conflict within your existing and living system. This can be conflict at work, conflict in the home, conflict with friends. This tends to trigger a lot of people, and this is where a lot of people tend to make impulsive decisions. Because, for example, if you are triggered by your boss and you decide that, you know what, I'm just gonna pack my bags and leave, I don't care anymore, So conflict can certainly now trigger a spiral of events that now follow up, because now you don't have a job, now there's no income, now there's so many implications of that. So other things include daily stresses, like school stress, marital stress, just general day-to-day stresses can actually trigger people. But we also have to remember that there is always a biological component to this that we must consider,
Okay, what's this biological component?
So the human brain is wired in such a way that there's certain parts of the brain that release certain chemicals, and these chemicals are responsible for the way we feel, our thoughts. They are responsible for our stress responses. So what happens a lot of time is that people will be stressed for a long period of time, and then these chemicals, they stop being released the way they're supposed to be released, and you have what we call a chemical imbalance in the brain, okay? When you have this chemical imbalance in the brain, it can lead to conditions such as your depression. It can lead to conditions such as your bipolar mood disorder. It can lead to schizophrenia. It can lead to, in elderly people, dementia, and the list just goes on. So
Alzheimer's and then.
Yes, that is the biological component. We sometimes do make the mistake of thinking that, this person is depressed only because there's stress with the wife, but only to find that there's actually these chemical imbalances that need to be corrected. We work hand in hand with psychiatrists for a reason. The psychiatrist, her role or his role is to give medication. The medication is not recommended because, we are bored and we don't know what to do. The medication is recommended to correct those chemical imbalances in the brain. Because if there is a chemical imbalance in the brain, me and you, we can talk until we are blue in the face. We can resolve all your issues. I can give you 50 million right now, but you still will go back to, the feeling of depression. You still will go back to having the symptoms of bipolar, schizophrenia, or whatever the case may be, because we are not dealing with the biological component. So it's always about looking at things holistically, not just, the stresses, but also medically, what is going on with the brain.
While we're on the subject of triggers and stresses, what's your take on the current surge of social media in terms of cyberbullying and actually influencing how people behave and also affecting people's mental illness?
Yeah. So it's definitely one of the main triggers, especially in the younger population. Unfortunately, we've just also witnessed that it can affect a person who is much older, in the name of the late Mr. Patrick Shine,
Yes.
the experience that he had with social media after whatever he was going through, that was one classic example of how things can go wrong
Yes.
in social media and the bullying that goes on. I think that, there's never black or white. There's always a gray area, because social media, in as much as we can use it to bully each other and, in a negative way, there is room for social media to actually do something good,
Yes.
and actually help people overcome their mental illness. But I think a lot of the time it is misused by people who probably themselves are struggling, they themselves are struggling with their own issues, and therefore it's much easier to point at you and say, look at your 10 pimples, than actually look at my own skin condition that I may have, So social media has certainly had, a large influence, especially amongst the young population. I don't know if you've noticed, but there are some sites and I don't know, is it websites or Instagrams that people create where they, especially the young ones, they teach each other things that, are quite scary. Like people who have eating disorders, for example, they will have this group where they socialize and actually give each other tips on how to maintain this eating disorder, like how to keep it going, how to remain safe. So social media can be quite problematic. It can be quite problematic. And I think it also speaks to the need for more boundaries in terms of what is allowed on social media and how we can actually guide and stop certain things from going public. Not everything, not every detail of our lives and every detail even of a celebrity's life needs to be in public. And unfortunately, most of the time, by the time you take down that particular post, the damage has already been done. Somebody has already posted it. Somebody has already taken a screenshot. So then it's that person is now at a loss. And you can see how one can feel quite helpless and isolated. And I think the most unhealthiest thing about social media is that, there's always only one narrative. There's no room for multiple narratives. And, once people decide that you're a bad person, now you will be trending on Twitter as the bad person, and that's what you are. But it's only a few people who will be like, hold up, wait, what is the other side of the story? And I think that is where people feel then powerless and helpless. And that's when people actually actively engage in thoughts of suicide and suicide attempts, because now it feels like the whole world is against me. So definitely social media can do a lot of damage.
Now let's take it to a place where we purportedly or supposedly think social media plays no role, right? You worked in the prisons. How's the mental health situation of prisoners or people that have been incarcerated?
Sure. I have to just warn you here that, I think in as much as working in prison was an experience that I appreciated, it's an experience that I don't think I want to ever live again, because it's a whole other world, It's a whole other world where mental health, a lot of the time, the resources are there, right? A psychologist at the prison that I was working at, I think there was 4 of us as psychologists, including an educational psychologist who was assigned to work in the juvenile center. So the resources are there, but the willingness of the inmates to actually engage genuinely in psychotherapy and getting psychological help is quite minimal. We do have those few cases where people are actually on medication, right? For whatever condition that they have in the prison system, they do receive their medication. So I think in that regard, the resources are available, but they are not being utilized by the inmates. There's a sort of reluctance in engaging with the emotional part of you, which I think in a way it makes a lot of sense, because when you are in prison, you are less concerned about your emotions. That's what I found. People are less concerned about their emotions, but more concerned about serving their time, more concerned about surviving actually in the prison system, more concerned about their protection, their safety. So if I found that a lot of the time, if I can't offer, something solid for the inmate, something solid maybe being that I'm going to write a recommendation for their parole recognition, they won't engage. So it's very difficult to actually gauge where exactly are our offenders when it comes to mental health. I don't think even to this day that I can genuinely say this is a clear picture of somebody who is in prison mentally. It's because they don't show up like that. When they show up, most of the time they show up with a mask, basically, and if it's not a mask, it's how am I going to benefit from this? So are you going to recommend that I do get parole? So are you going to, it's almost like a transactional relationship more than a therapeutic relationship. So it's very difficult to definitely say prisoners are mentally healthy or mentally unhealthy. What I can say is the resources are there, it's available. It's just now the willingness of people to actually make use of what is available.
Based on the availability, what interventions have been done then, just to change the status quo a bit? I understand the importance of survival and them obviously looking out for their lives in the physical sense, but in terms of mental health, trying to promote it in such dire circumstances, what interventions were there while you were working there?
So we used to do different things, right? Most of them, we would obviously get them as referrals from the parole board to say, please see this person for psychotherapy sessions. Let's see how they are mentally. Let's see how they are emotionally, before we can actually consider them for parole, right? But what we did and what is still going on in the prisons is that a lot of groups are being run, okay? So there is, for example, entry-level groups where people that have just been recently sentenced, they are basically, they are obligated to attend this adjustment group that teaches them how or what is expected of them and how they can reach out for help, and so sort of making them aware of what is available in the prison and what they can do to make their prison term more bearable, for lack of a better description. So that was the adjustment group for incoming ones that have been recently incarcerated. But there's also, I think specifically, I recall I was running a group for people who were serving life sentences, right? So these are people that have been or are going to be in prison for a very long time. So we don't know when they are going to get out, if they are going to get out. So that was basically a support group. Né? And surprisingly, we used to call them lifers. The lifers were more receptive and more ready to come in for the sessions than any other group, like the group of people that have been sentenced for 5 years, for example, those ones were less willing and, to come through. The lifers were emotionally mature, if I can put it that way. There was a level of maturity emotionally that was involved there. So running a support group for them was something that was actually quite positive and quite engaging and growthful on both ends. But there was also other psychoeducational groups. Most of the work that is done there is done in groups. So psychoeducational groups on how to deal with trauma, how to cope with substances. Substances was a big thing, how to cope with substances, how to deal with stress, when to know if you're not okay. So there was a different intervention, or they still are in different interventions at any given point in time. So the efforts are always there. I think that is the one thing that I was, very proud of. We always speak of what is missing, what is missing. But I think that in that scenario, I think I recognize some of, the work that our government is doing, in terms of getting professionals involved and trying to rehabilitate these people that have been incarcerated. So, like I said, resources available, willingness,
not so much. Interesting. You mentioned substance abuse, right? As one of the major issues in the prisons for when it comes to just coping and just living life, right? Now, looking at it broadly and in the aspect of mental health, substance abuse, pornography, gambling, other addictions, what role do they play in terms of mental health?
So, remember earlier we spoke about how different people cope differently with their stresses, right?
Yes.
For a lot of people, a habit like gambling, a habit like pornography, a habit like drug abuse, alcohol abuse, it is essentially to help mask certain experiences. One thing that I always ask my patients who may be struggling with substances, especially alcohol, if we take that as an example, I always ask, okay, but why are you drinking? Are you drinking because you enjoy the taste of alcohol? Are you drinking because you want to change the way that you feel? You want to feel more bubbly and sociable? Are you drinking because you want to numb? Are you drinking because you want to sleep? You are not able to sleep. Then if those are your reasons, you are drinking for the wrong reasons. If you say to me that I'm drinking because I just enjoy the taste of alcohol, I can take that. But if you say to me that I'm drinking because I can't sleep, one glass of wine helps me sleep every night. One glass of wine helps me then get through the day, the stress of the day. If I drink or if I use the substance, then I don't have to think about my problem. I don't have to think about my pain. Those are not the reasons to drink. So people use substances to mask feelings. But the sneaky thing about feelings is that after all is said and done, in the morning, the feelings come back and they say, "Expert clever."
I'm still here.
You have to deal with me, and what happens? Oh, and reach for that bottle again. You go and reach for that cocaine again, because now the feeling is back, and that's what we are trying to run away from. And that's how people then find themselves in this never-ending cycle of abuse and being dependent on substances.
And then in terms of that aspect of substance abuse and other addictions, do you think enough has been done to basically focus on mental health and how it affects people's health?
When it comes to issues of mental health, I don't think we will ever reach a point where we can say enough has been done,
Too complex.
Yes, I think it's a work in progress. It's always a work in progress. It's not a once-off thing that we can say, okay, we've built a rehab, so we tick the box and we move on. we need to then maintain that rehab. We need to then inform people that these resources are available. We need to then make sure that, the people that are working in the rehab are knowledgeable about substances and how to intervene. We need to have measures in place in terms of how to keep people from relapsing. So I don't think enough can ever be done. It's an ongoing process. It's an ongoing process that doesn't need to have an end. We can always do better. I think in that regard, especially, we can always do better. It's just a matter of, finding new ways and constantly evolving those ways of reaching out to the people and allowing them actually also to reach out, because that is very important. Because you can reach out to someone and they're not ready and willing to receive your help.
100%.
So in essence, I don't think there can ever be, a point where we say it's enough. We are doing enough. I recall one of my former lecturers actually used to say that we, as human beings and as a system as a whole, we are constantly in the process of becoming. We are constantly becoming. We don't stop becoming. So we need to constantly be working on things and trying to get it to a better level, trying to get it to a more productive level, trying to get it to a more updated level. So I think in that regard, to answer your question, when it comes to substance abuse, that is one field that, it needs a lot of attention and it needs a lot of maintenance, and we need to continue to become more effective in managing it.
I like that answer. And I also like what your lecturer said, in relation to us as humans aiming to improve ourselves at every goal. So what practical steps, if I'm suffering from any type of mental health illness, maybe now under an umbrella type of approach, what practical steps can I then take to help heal, to help circumvent the impact of these mental health illnesses? What can I do, Pinky? Let me know.
I think one of the first things that needs to happen is acceptance, right? There is a lot of denialism around mental health and the impact and what needs to be done in order to get help. So acceptance is very important, in that acceptance doesn't mean that you are accepting defeat. It doesn't mean that it feels good. It means that you are accepting and adjusting to your reality in the here and now, right? Adjusting to your reality in the here and now may be that, actually I need help. And this help I'm not gonna get, only within myself. People don't come to therapy as the first option. You try by yourself under normal circumstances. You try by yourself to fix the problem as much as possible. You try by yourself to, be okay. So by the time people come for therapy, by the time people come to us, they are basically at, their wits' end. They are saying, I need help, I'm not okay. So when you accept that you are not okay, you are able to reach out for help. You are able to then, find the relevant people. And it doesn't always have to be, a psychologist, a psychiatrist, a professional. I think, it starts with the people that are closest to you. But of course, not everybody has that available. Not everybody has that solid support structure. And that is where we as professional psychologists, social workers come in. So you accept and you seek for help, and you actually comply and follow up with the help that you receive. Because if you are diagnosed with a bipolar, for example, there may be stresses that are affecting you, whereby me as a psychologist, I will see you and we will try to work on those. But then you will see a psychiatrist who will give you medication. It's very important that you comply with the medication. You take it the way it has been prescribed, You continue with the medication until your doctor says otherwise. And when it comes to being in therapy, therapy is a relationship, essentially. When we engage in a therapeutic relationship, the both of us need to decide at every interval, where are we at? Are we at a point where you want to give your life a try without therapy for a short while? And with the knowledge, Yoguti, should I need help? The resource is available, the therapist is available. I just need to reach out. Ne? So not everybody will want to stay in therapy forever. And ideally, I prefer that, people actually don't stay in therapy forever. People actually learn coping skills through therapy, and they go out there and they live their lives. You live your life with the knowledge that, when I'm in need, I will reach out and I will get the help that I need.
Generally, proponents of holistic health look at other elements. As you said, people come to you guys at their wits' end, right? So generally, people will look at issues of your diet, exercise, solid support structure around you, vitamin D exposure to the sun, those type of elements. Where do you think they fit in based on the coping mechanisms that you as professionals give out there to the public to use?
I think that's a very good question. And it's something that is almost always missed. What we need to remember is that as human beings, we are not just physical beings. I think, or I believe that, we have three ways of existing as human beings. We exist physically, we exist spiritually, and we also exist emotionally and mentally, right? Those are, the three ways of existing in life. What happens a lot of the time is that, we focus on one more than the other, and therefore the others are then lacking and then affected. And we should always be striving for balance. You need to balance your spiritual life with your physical health, with your mental and emotional health. Because if I give you an example, if you are sick physically, you go to the doctor, right? If you stay sick and you don't go to the doctor, you don't deal with, your physical illness, what will start to happen is that emotionally, mentally, you're going to get tired. Spiritually, then you're not going to be able to engage in whatever it is that you believe in on a spiritual level. Because where will you get the energy? Where will you get the strength? The same applies to when you deprive yourself of, being healthy mentally. Mental health is actually, very, very important in that it informs then how you deal with your spirituality and how you deal with also your physical health. A lot of people who are suffering with mental illness don't always have the capacity to take care of themselves physically. So you will find people that will say, for example, I'm not eating at all, or I'm eating much more than, I used to. I'm actually binge eating, which then what does it do? It affects your physical health. So all three are related. The goal is to always strike a balance between your physical health, your mental health, and your spiritual health. And that is something that I always encourage, my patients, that there's no one that is important over the other. If you neglect the one and focus on just one, then it means that the others will suffer. So the goal is to strike a balance. Each and every part needs to be well taken care of, well maintained, and know when to actually seek help for each part.
I like how well-rounded you are. You touched on spirituality whilst addressing the issue of a holistic approach, right, in the last question. I'd like us to expand a bit more on the element of spirituality and how it links up with mental health, or how we can use it as a tool to overcome certain things.
So I think I've been privileged enough, I want to say privileged enough to have had an opportunity to actually, during the master's course, study African psychology, right? And when we speak about African psychology, we're not just speaking about, people of color, but Africans as a whole. and what spirituality means to every individual. And one of the main things that I learned from that is that, reality, there's a saying that says, reality is a multiverse, meaning that there is different ways to interpret life, there's different ways to interpret reality, So spirituality is a part of us. We can't discard of it. But spirituality is also dependent on what you believe in, right? So for me, spirituality might be connecting with my ancestors, but for the next person, spirituality may be going to church and connecting with, the religious part of themselves. For other people, spirituality comes with things like mindfulness and meditation. So it's about finding what speaks to you on a spiritual level, engaging with that, and using that to actually get you through, times that are tough mentally, using your spirituality as one of the tools to actually help you heal. I mean, there's a reason why there's, certain rituals that are performed, for example, funerals, when a person is dead, we could easily say, okay, the person is dead, put that person in a hole and, life goes on. But holding a funeral, I think it's a spiritual journey, because it's a service that allows us to say farewell to this person and also give us actually closure. Yes. So spirituality, it refers to, or it relates to each and every one of us in a different way, and it is also healing in different ways. So it's not something that can be discarded. It's something that we can actually use to heal ourselves.
Nice. Can I bring it a bit closer to home and ask you, as a psychologist, have you actually experienced mental health illness of any sort and are willing to speak about it? And just to bring that point home, to say, in the beginning, we said it affects everyone. Does that everyone include you guys in the profession?
It's actually funny because when we made this appointment to have this interview, I said to you, I have a doctor's appointment at 4:00, right?
Correct.
That is actually me going to see my psychiatrist. So I myself, I'm not immune to mental illness. I come from a family where my father is actually schizophrenic, well managed, on medication, and he's basically living his life despite the mental illness. So I think that on its own made me, as his child, vulnerable, to developing a psychological disorder. So I think I was diagnosed with depression when I was 16 years old, if I recall. So I was diagnosed with depression when I was 16 years old, and I think through therapy and being involved in that whole process, I found myself very functional. I can function. I don't need to be hospitalized for my depression. I take my medication as prescribed, and I just get on with it. You just get on with it, because in as much as I was diagnosed with depression, I am living with depression and anxiety, but that does not define me. I'm still Pinky at the end of the day. I'm not depression. I don't walk around as depression. I walk around as Pinky Gwebu. I walk around as Mama Zilibushe, So I think it's like I said, like we said in the beginning, nobody is immune to it. Not everybody will get it, but certainly should the need arise, don't be ashamed in seeking help. I'm not ashamed of the fact that I'm a psychologist living with depression. I didn't go out there and seek it and find it. You know, it found me along the path of life. And I've had to kind of find a way to function with it. And to blow my own horn, I think I'm quite well functioning.
Yep, you're doing pretty well. Thank you so much for opening up. Thank you so much for opening up, because you know this thing of mental health being a taboo, which I actually want us to jump into. But before that, the hereditary aspect, you touched on that, and we almost actually missed such an important aspect to mental health. Maybe just enlighten us a bit regarding people inheriting a mental illness or the possibility of that happening.
Okay, so we have this thing called genetics, right? So with genetics, one will have a predisposition to develop certain illnesses because, you know, there is a direct family member, or in the case of mental illness, extended family members who have lived with mental illness before. So what I mean by genetic predisposition, I mean that, you know, genetically, a person like me whose father has schizophrenia, genetically, I am vulnerable to developing a mental illness. And you have to remember that, you know, vulnerability doesn't, you know, always correlate to what the previous generation has had. My father, for example, had schizophrenia. I developed depression. So it doesn't mean that just because my father developed schizophrenia, I'm going to have schizophrenia. It can be a different type of mental illness. But in some cases, it can be the same. When you have that, when you have that genetic predisposition, what happens a lot of time is that, you know, it is then triggered by a stressor. It is then triggered by certain events. It is then triggered by those chemical imbalances in the brain. Whatever the trigger is, then one will develop, you know, a mental illness. But when we take history, we always consider that, you know, who else in your family is living with a mental illness, because that actually tells us that it gives us information around your vulnerability. One thing that is important is that not everybody who has vulnerability will go on to have, you know, a mental illness. You know, not everybody who has vulnerability will go on to develop that. If we take it back to myself, my father has schizophrenia, but my sister and my brother are perfectly fine. Never had to see a psychologist, never had to see a psychiatrist, but I have had to. I developed it. And this simply speaks of, you know, the fact that different people react differently to, you know, situation. And our biological makeup, although it informs majority of how we're going to respond, also our psychosocial and emotional functioning does also inform whether or not, you know, that genetic predisposition and vulnerability will be triggered.
Oh, wow, interesting. So now, with knowing that someone in your family, you know, from a young age knew that there was this mental illness that existed, how did the rest of the community and society at large respond to that? Was that taboo still there during the time when you were growing up? And has it changed over time? And what exactly can one do around shaping and molding this information of mental health so that it doesn't continue the way it is currently?
Definitely. There was still a lot of stigma. There still is. And I think as a result, mental illness is kept as a secret. I don't think anyone in the community that we lived in knew and understood that my father was schizophrenic. I don't imagine anyone knew that I was also suffering from depression, you know? So it becomes something that is hidden. It becomes something that we sort of try to keep a secret. We manage it. we manage it very quickly. We see that this person is not okay. We manage it very quickly, and then we are able to get back to normal life. So there is definitely that stigma. And I think there's been, like I said, a lot of denialism around mental health. One thing that has been popular recently that I've been seeing quite a lot is the discussion around, bipolar mood disorder and ancestral calling. I mean, there's now a lot of research that is being done in that field, and people are actually considering that, a lot of people who carry a diagnosis of bipolar or who are undiagnosed, they do find themselves going into initiation schools. They find themselves, carrying things like becoming traditional healers when they themselves are struggling. And, for some people it works, right? For some people it works, and they are able to then follow their calling and carry on with their lives. But for some people, it's actually quite detrimental, because it means that they stop taking their medication. They stop taking their medication. And what happens is that the chemical imbalances are now, being triggered, and you find a person now, eventually they go into crisis. So that is one form of denialism. But if you can recall, there has been, especially in the Black community, when somebody is presenting with symptoms of schizophrenia, they would call it amafufunyane, ne? And amafufunyane was considered as almost like an evil spirit that you need to be cleansed of, or you need some sort of what do they call it when they exorcise? You need some sort of exorcism to get rid of amafufunyane. And people were taken, a person who's struggling with a psychotic episode, a schizophrenia, is taken to church, and only when that person in that church, for example, all hell breaks loose, they start to beat up everybody, they threaten to burn everything down, only then do people seek help for this person. It's the same as the people that we see in the streets, carrying, a lot of dirt and junk, and they are not. They are unclean. They've run away from home. They are living on the street. You can see that this person is unwell. But most of the time, we just let them be until they hurt someone or they hurt themselves. And I think that is something that becomes very problematic, because it now contributes to the stigma that mentally ill people are dangerous, with that not being a true reflection of what the situation is. The situation is that most of the time we seek help for them once they become violent towards themselves or violent towards others. So there's a lot of work that needs to be done in terms of educating people around mental health, educating people around, how to actually seek help for your mentally ill loved ones, and so on. So there's a long way to go. But what I'm appreciative of is conversations like this, conversations like this. I strongly believe that, if we can touch one life, that one life can actually touch another life. And eventually there will be this ripple effect where different people are getting help at, different points of their lives. So, yeah.
100%. Maybe before we conclude, can I just jump on the bandwagon of something you mentioned? You mentioned the people who may have mental health problems, and we see them on a daily, right? And then we spoke about the element of them needing to be assisted, but only when we ourselves have seen them hurt others. Can you maybe touch on something that I read or learned regarding the people who hurt people who have mental illnesses? Because I know that it's a crime to do something like that, particularly when they've been declared medically so.
So, for every human being, I think one of our most important need is, a need for safety, right? It is very important that, you feel safe. And when when something or someone is threatening your safety, you will obviously react to it and try to protect yourself, right? So when it comes to people who are mentally ill, that we see on the streets and so on, should you be concerned, I think the process and protocol is always that, you try to engage with your local community. I think we shouldn't wait until they hurt someone, The local community clinic is always able to assist. I think I'm working currently in the Tembisa region, right? And in the whole of Tembisa, almost each and every clinic has a number of psychologists and psychiatrists and social workers that have been deployed to those places. So we do have, community-based outreach programs so that people know that we are available and how to reach us and make use of our services. But I think the one thing that is important for everybody to know is that we don't have to wait until that person harms themselves. We don't have to wait until they harm someone else, because if you get to a point where now you have to defend yourself against this person and they die, there's a whole lot of legal implications, and you might find yourself in a lot of hot water. So I think it is not waiting until there is a crisis. It is actively actually going into that clinic and saying, there's this person that, I'm worried about. And the social workers specifically, they are able to actually go out in the community and help actively the community with home visits and actually assess and see how we can assist this particular person. So it's about using our available resources before we get to a point where somebody is getting hurt or hurting other people.
Nice. I've enjoyed how much knowledge you have, and I'm honored to have had this conversation with you. Just as a parting shot, what would you like the starters to just remember about this conversation from you, and maybe in that parting shot touch a bit on men and women suicide as well, and also just where can you be reached if people want to reach out to you for whatever reason?
Okay, so I think the starters need to understand that, mental health is a reality. It is something that is there. It does not choose economic status. It does not choose race. It is a reality. And we just need to find ways to seek help, right? And that it is okay to feel the way that you feel, people will often feel like it is wrong, for example, to feel suicidal. I say, it's okay to feel suicidal, but what is not okay is you acting on those suicidal thoughts. You can feel suicidal, but acting on those thoughts is something completely, and feelings is something completely different. And that is when you know that, actually you should seek help. I strongly believe in that. If you are alive, a plan can be made. If you're still breathing, we can actually try to work out some sort of solution. Maybe not in the immediate, but it can be a work in progress. So if you are alive, a plan can be made. But once you're dead, you're dead. There's no coming back from death. There's no coming back from death. So we need to be able to reach out, seek help, and understand that, I once read something, I think it was with the South African Depression and Anxiety Group, and they had a slogan that, suicide is it's a permanent solution to a temporary situation, because things can change tomorrow. You never know, because you will be dead and you will not have given yourself a chance to actually experience tomorrow. So I always say, trust yourself enough to give yourself a chance to experience tomorrow and see if tomorrow is different. And also, I think an example that I always give is that I'm sure you've been to the shops where you see a little one walking around with, the parent, and when they get to the kiosk, when they're supposed to pay, all hell breaks loose because this little one wants a piece of chocolate, and they feel like, if I don't get this chocolate now, my whole world is gonna fall apart, and they're throwing the biggest of tantrums. In that moment, that chocolate feels like life and death for that little child. But if you meet the child now, the child is 25 years old, and you ask the very same child, Hore, did that chocolate really matter? Was it a make or break in your life? And it's like, actually, no, it was a moment. It was a moment. So we need to accept our here and now, but with the understanding that your story doesn't end here. This is where you are now, but it doesn't mean that this is where your story ends. So reach out, seek help. Like I said, almost every clinic has a clinical psychologist that is assigned. If your local clinic does not have, a clinical psychologist assigned to that, they will refer you to the nearest one after that one. So the options are there. It's a matter of standing up and taking responsibility and seeking help. And at the end of the day, we all have, a choice that we make. As a psychologist, I hope that you can trust me to help you get through, a challenging time. But unfortunately, we are not always able to prevent a person from making a decision of ending their lives. At the end of the day, it's a decision that one makes, But one point that I would like to leave you with, and it's also not my saying, but something that I came across, is that suicide does not take away the pain. It actually transfers the pain to those that are left behind. So now you have to think, if the very same pain that you are feeling, you want, your loved ones to bear, you want your loved ones to experience it. But at the end of the day, like I said, suicide is still a decision.
Thank you so much, Pinky. I appreciate the conversation, the input, the lessons, the information, and overall the wisdom. And of course, for you actually giving us your time and mind throughout this entire process. Starters, I hope you've learned a lot. I hope you'll apply the lessons, and I hope we'll just grow further and further as the journey continues. Remember, ultimately, it starts with you and I. Cheers. Thank you so much, Osakane.
Yes, thank you for having me. Much appreciated. Thank you. Thank you. You too. Bye.